Once again, welcome. This is day 2 of our Accreditation Conference, a local health department skill building conference. Hopefully that you will learn a lot of interesting things today, some things that you can use when you go back into the community. We are fortunate this morning to have 2 very skilled people to teach us how to go back into our communities and use facilitation methods to get people to work with us, to get people to prioritize the issues they want to work on, and to get them to buy into what's happening in the community. Our first speaker today, Mary Flanagan, is currently a consultant with Management Solutions Group. She got into this in 2003 after 25 years of experience in planning and project development, fundraising, coalition building, leadership development, management in the nonprofit arena. Some of the clients that she's worked with are the San Antonio Symphony, the University of Texas Health Science Center in San Antonio, the Girl Scouts of Southwest Texas, Texas Public Radio, Valero Energy Corporation, and the Texas Nurses Association, amongst others. And I love the one sentence in here because this is really what this is all about. With each client, she helps groups clarify the issues and challenges they need to address and helps them create working solutions that they believe in. And that's really what we need to be doing with this process. She has a master's degree in social work from the University of Houston Graduate School of Social Work, with her focus is on community and organizational development. She has a master facilitator status, so she knows what she's talking about. And also, just of interest, she was a long-distance runner until her knees decided to act up on her and completed 6 marathons. That always impresses me. Our second speaker today will be Kathy Shields, who's currently the Chronic Disease Prevention Manager with the San Antonio Metro Health District. She started out there after her Bachelor of Science in Community Health Education and certification as a health education specialist. Started out as a health educator working with cancer prevention, teen pregnancy prevention, and chronic disease prevention. And then she spent a few years with the Texas Department of State Health Services in the position of Public Health Promotion Manager with a 28-county region in South Central Texas. She went back to San Antonio in 2002 and worked as a special projects manager, managing and facilitating community-based strategic planning processes for improving health in San Antonio and in Bexar County. And she took over the position of program manager in 2007. And some of the things that she has to work on now are the Steps to a Healthier San Antonio, the Healthy Kids Community Project, Healthy Eating and Active Living projects. A lot of hers funded by the San Antonio Restaurants Coalition and the Robert Wood Johnson Foundation. So you can see both of these people have experience in the areas that we're looking at, how to improve the health of our communities. I'm really looking forward to the presentations today, and without further ado, I'm going to turn it over to Kathy and Mary.
Well, good morning, everyone, and thank you for coming this morning, and thank you for having us here today. I know that yesterday you spent some time looking at data and how important it is to know the health of your community in terms of the data and hopefully some community feedback. And so we're going to kind of move a little bit forward today in talking about how do you engage community in your planning process and in your public health programs. And also, how do you, use some facilitation techniques to help gather information from community partners and stakeholders and yourselves as the public health professionals and begin to move towards priorities. So that's kind of a little bit of a recap right now, but what I want to do first is just for my benefit and for Mary's benefit, if you wouldn't mind simply stating your name and the organization that you work with. That would be really tremendously helpful for us to know, the makeup of the folks in the room here, and so that we might be able to tailor a bit of our presentation to maybe better reflect what you're going to need or the information that you're going to need to know about. So I'm just going to start kind of in the first row here of folks. And if, again, just your name and just the organization you work with, that's all that would really be helpful for us, right here in the purple.
Lynn Roy. I'm currently unemployed but looking.
Fantastic.
Melissa Kim, I'm employee of the county of Health.
Bride Roberts with Williamson County and City Health District.
Mary Kate Sturp with Williamson County and City's Health District.
Okay.
Teresa Estes, City of Houston Department of Health and Human Services.
Ron Sandberg, Houston Health Department.
Jessica Paul, Rutherford Health Department. Sarah Mendez, Rutherford Health Department.
Maureen Data Beckett with Galveston County Health District.
Okay. Way over there.
Joseph Raleigh, Texas Public Health Training.
Elizabeth Floyd, University of Texas School of Health.
April Scott, City of Amarillo Health Department.
Rick Curry, University of North Texas Health Science Center, School of Health.
Cody Green, State Department of Health.
Chief Services Public Safety.
Virginia Rodriguez, San Antonio Metropolitan Health District. Dennis Corbin, County Health and Human Services.
Marty Lowe, retired from the University of Texas School of Public Health. Bobby Schmidt, Schmidt and Associates.
Patsy Gaines, Lotto County Health Department. Diane Levin, Albany Health Department.
Mary Lou Cornejo and Jeff McCullough and the County Health Department.
Gordon Campbell, Lincoln County Health Department.
District Capital Population Health Consultant.
Gary Tucker, City of Belmont Public Health Department.
Jennifer Edwards, Dallas County Health and Human Services. Ola David Colbert, Houston Health Department.
Rover, Houston.
Alicia Mendez, representing Health District. Kathy Palmer, Dallas County Health and Human Services.
Greenberg, Benton County Health Department.
Angela Tully, Wichita Falls, Wichita County Public Health District.
Joe Condit, Texas Tech Health Science Center.
Teresa Dodd, CDC. Jackie Dingley, University of Texas at Austin.
Jennifer Smith, Cal Health.
Well, thank you, and some familiar faces in the crowd. Nice to see you all this morning. Okay, so let me recap once more. So I am going to describe some of the steps necessary for organizing and activating the community in collaborative efforts to improve community health. So how do you bring in the community? That is the big burning question always. Following my presentation, then Mary will share some keys to effective facilitation. And then we're going to actually break into two groups, and part of you will stay in here and part of you will move into a room across the way. And we're actually going to demonstrate, Mary and myself are going to demonstrate some community facilitation techniques that you all can hopefully use in your community. And it'll be a very interactive, hands-on, fun opportunity to see demonstrated how effective facilitation can work. So I just want to reframe maybe community building, community engagement, bringing people together. It is not so much a process, but rather an orientation or a way of looking at things to the community that is strength-based rather than needs-based, and stresses the identification, nurturing, and celebration of community assets. So one of the things that we are kind of playing with right now in San Antonio in terms of our public health department and how we identify community partners and engage community is really taking it to a very small geographic level. And this has really challenged us in some ways, because typically we would look at a community, how to bring in stakeholders or how to identify a target community in a bit of a larger geographic area or a bigger section of the community. But what we're doing right now is we're really challenging ourselves to look much smaller at a neighborhood level. And so it's helpful in terms of thinking about the community's assets rather than its deficiencies. And I know because I know I have been in enough grant preparation meetings or program planning meetings, and I know this is going to be your experience too, that typically what we do in terms of looking at our communities is identifying all of the things wrong with the community, looking at the data and really finding all of the health disparities and all of the deficiencies, and then moving forward with program planning from that standpoint. But what I'm going to challenge you to do a little bit differently today, this morning, in these steps, is to think about it in terms of not so much the deficiencies or the problems or the issues, but really what are the assets? What are the things that are the strengths within the community? So I just wanted to put that as kind of a frame behind the rest of the presentation. So, okay, step one. And there's just a few steps, so bear with me. Step one, identifying leadership. If you are planning to bring together folks in a collaborative way to move forward on your health improvement plan or your strategic plan, then the first step that I would suggest to you is to think about the leadership. Bring in folks, and this, again, this is in terms of internally within your organization. So not quite at the point where we're thinking about the stakeholders outside, but internal leadership. Who are you going to bring to take on a leadership role? Determine the size of the collaborating committee. So this small group internally who will kind of steer the ship. You want to start with those folks and the key allies, possibly. So you might start with some, I'm going to just suggest maybe 5 or 6 internal folks who, or less, doesn't necessarily need to be that many, who will be the driver. And then think of maybe a couple key stakeholders that really get it and really are bought in and are allies for you. And this becomes kind of your collaborating committee, the coordinating committee, I'm sorry. Then identify and meet with potential catalysts. So again, thinking of just a small number of external partners that you know are already bought in. Everyone will come with their own agenda, and that's okay. But the idea is that you find a way to make each of those agendas fit together. And sometimes, you want to begin with the individuals who are already interested in the process. And one thing to keep in mind too, and this is a really challenging piece of it, is that it's also important at this stage to, if possible, bring in someone from the community who is actually impacted by the things that you see need to be changed. So the people that are experiencing or most affected by the problems that you see in your community, always nice to have someone at the table who can kind of represent that voice. So, and that can be a challenge, and in your communities how you might go about bringing that person in, or maybe you've been successful in doing that, but they can bring a really interesting and significant voice to this, again, this small kind of committee of folks who are going to lead your effort. The second step would be to define the scope and parameters very clearly of what you're going to be doing. And and as I mentioned in San Antonio, we're taking a very microscopic look at communities now and really selecting target areas that are literally a few blocks wide in a neighborhood. And so one of the things that we've learned in this new method is that you really have to define the community. And I'm going to be really specific and talk about it in terms of the geography, the streets, the boundaries. Be very clear about what community you are looking at. And that will help you know which partners to engage, which stakeholders to bring in. So define the community, be specific, and then clarify the costs and benefits of collaborating. And what I mean by that is really there are benefits to collaborating, as you all know, taking advantage of everyone's resources who are could be potentially around the table. And then, of course, focusing on those assets as you move forward. So defining the scope is about defining the community, being very clear, and then kind of taking advantage of the resources that come together around your table. And then thirdly, developing and implementing communication vehicle, a communication vehicle. As you know, and I know you have been involved in situations where you're responsible for bringing in folks on a committee or in a planning process, and you want them to be engaged for a while. So it's not just a one-time thing, but you want these folks to come back and to be part of a process. The most important thing is, how are you communicating with those folks? And this is where developing your key message. What is it that you are asking folks to come around the table for? And be, be intentional and intentionate and excuse me. Be purposeful in making it a very compelling reason. So developing the key message is really about also making it very compelling, and then taking advantages of all the connections and relationships within your community and within the folks who you've engaged early on. Framing the issue or the problem and the goals, framing the issues, problems, and goals of the efforts. Again, making it compelling, and then using appropriate literacy levels and cultural competencies. So the communication is key because this is how you're going to keep people engaged. This is how you're going to explain what you're doing to others in order to recruit others, which is the next step. And think of it in terms of, we talk about it in terms of an elevator speech. If you had 5 minutes in the elevator with the mayor, what would you say about what you're doing? It's a community health improvement process, sure, but think of it in terms of something compelling that you could explain to someone who is not from public health, who doesn't know kind of the lingo and the jargon that we use all the time. So the communication is really key. Okay. The fourth step is to research your potential stakeholders. So this is where you're going to think about expanding this group, bringing in the community partners that aren't kind of the people who are already bought in and already going to come to the table when you ask them the first time. So identifying the stakeholders is probably something that you already know the answer to. I'm guessing in your communities, when you think about public health and when you think about the issues that are impacting your community, the stakeholders come to mind that you want to have at the table. And so those are the folks that you should certainly bring in. I would think, I know you've probably seen the graphic that's in my mind right now. It's kind of that public health web where it's got the public health department or the local health department in the center of the web, and all around the public health department are all these lines and connections that go to all of the different parts of the public health system. That's in terms of what I'm thinking of when I'm thinking of stakeholders. People who are part of the public health system, who have a role in the public health system, who you would want to bring in. Agree on the sectors and organizations from which representation is needed to ensure success. So when you have your folks around the table, you would want to be asking them, who needs to be part of this group? Who should we bring in to represent the community and to represent the partners? Identifying the gaps. Stakeholders should reflect the diversity of the community. So once you have that initial group of stakeholders around the table, then it's always best to look around and say, okay, is every voice represented in this room? And representing the diversity of your community as well. And again, if it's a target community, thinking about the diversity within that particular target community. So you want to make sure that you have representation of all of those groups. And then this is probably the most important piece of it. Reduce the list to those who have time and to those who will take the time. You know that when we invite folks to come into a planning process, it's going to take some time. And the most important thing is that you have the consistency of the participants instead of kind of people coming and going throughout the process. So it's okay at this point to look at your group of stakeholders and say, you know, even though that particular partner is pretty important and would be really great to have at the table, we know that they're not going to be able to commit to this. That's okay. I would say move on and go with folks who you know can be there for the long haul of it, or at least for the most important pieces of it. Okay. And then inviting those stakeholders. So now is the time when you actually reach out to folks. And what I would say is I would challenge you not to do what we normally do, which is craft up an email or type up a letter and mail it out to whoever we want to come. No, I think there's a better way to invite people to the table. And this is, again, part of what we're learning in our new plan to work with smaller communities and taking advantage of some of the techniques in asset-based community development. instead of doing that invitation out, mailing, emailing, whatever your normal method is, do a one-on-one invitation to that person. And always talk to the people that you know and utilize your network of internal, that first committee that you brought together. Utilize the relationships that they have to make a personal connection with whoever you want to bring into the room. So that means that I'm never going to talk to someone I don't know, and that's okay. I'm going to reach out to the people that I know and say, we really want your voice at this table. And then my committee is going to do the same thing. And hopefully by that time, you've cast a little bit of a wider net, and it's based on a one-on-one interaction and a personal invitation. And then you just continue to spread that web. So as those people are coming on board, you say, could you ask someone that you know who you think might really lend something to this conversation to come to this table as well? And so every invitation is a personal invitation. And I challenge you to try that because it really works. And it's a totally different approach, but it's something that we realize is very effective. May take a little more time, but it's going to be worth it. Create a clear, compelling, and intriguing invitation to a diverse audience. Again, kind of the technique that I mentioned. Never invite someone that you don't know. Utilize your partners for that. Meet them where they are. Pretty clear. I know I don't have to explain that to this group. And then create a process for monitoring responses. So, we want folks to commit and we want them to be part of the group. So this is where you would set up this, I guess you could go back to your traditional methods of kind of a RSVP list, names, numbers, email addresses, phone numbers, so that, you can keep track of the group. Okay, build trust and credibility. And by the way, this is actually the last step in the process. So I think that it's about making things flexible, friendly, efficient, and effective. And one of the things that you'll see today, hopefully, you will experience how external facilitator can really help to make your time efficient, make it fun for people to be involved with. It's a friendly environment. You really want to take good advantage of people's time, and I think that being purposeful about making the agendas action-oriented and forward-moving is really the way to do that. Also, to be clear about your mission. What is the purpose of bringing the group together? State that up front so that people know what the expectations are. If it's about developing a list of public health priorities and then beginning to move forward on planning for those priorities, be as clear as you can about that particular task so that everyone knows what they're kind of getting into. And make each person feel his or her input is needed. Again, in our demonstration today, you'll see that in action, that what will happen through the workshops that we're going to be doing with you only happens because every single person in the room participates. Their voice is needed. And one of the things that Mary and I know, because this is kind of a part of the philosophy of the facilitation techniques, is that all of the knowledge that is needed is in the room when you are conducting that meeting and facilitating that process. So everyone's input is needed, and in fact, that is how you move forward. And then also thinking in terms of action-oriented agendas, how do you want the people to feel when they are in the room and participating, and how do you want them to feel when they leave the room, and what product do you want to achieve within the time that you have with them? So being very clear and purposeful about those things right from the get-go is it's part of how you build trust and credibility. People don't want to feel like they're being taken advantage of or their time is being wasted. So those were the simple steps of how to kind of engage community in a meaningful way. And then just to kind of recap and some tips for success, honor and build on community interests, priorities, and assets. Thinking of it in terms, again, not so much of here are the problems, issues, challenges, health disparities facing our community, but thinking of it in terms of priorities and assets that are available and how you will take advantage of those to change those problems or issues. Identifying and leveraging existing institutional relationships. Kind of going back to that, never invite someone you don't know. Take advantage of the relationships that you have and use those to draw in more folks, more appropriate folks possibly. Define and communicate the parameters of joint health department and community efforts. So, you know, obviously there have to be some kind of guiding principles when you come together as a group. So kind of defining, you know, what's my role, what's your role, what are we asking of you, what are we bringing as public health department folks, what are we bringing to the table, what's our responsibility? Again, another tip, provide support to maximize and maintain community participation. And then document and communicate the link between community engagement strategies and improved public health outcomes. Okay. At this point, Mary's going to share with you some effective facilitation techniques, and then again, we'll break up into the two groups and go through the activities.
Kathy and all of her colleagues at Metro Health in San Antonio make me so proud. All of the folks on her team who is out in community trying to engage community to have a healthier future in San Antonio, they've all had these methods and training. They've been recognized nationally as the particular methods that we're both going to demonstrate today are called TOP, Technology of Participation methods. And Metro Health has been recognized by our national entity as top champions for their work in furthering. Back in San Antonio was one of the very first MAP City Awards. And Kathy embraced, I was honored to be able to participate with them, and took to, is it NACHO? Took to NACHO the importance and the value of having these real facilitation techniques engage and embrace community as opposed to just sort of going through the boxes and checking them like I learned to do in graduate school and you all may have learned to do in graduate school. So I commend Kathy and the entire department. What we're going to do, oh, one more thing. I am chairperson of our national association, and there is a whole nationwide action effort called the PHAT team, P-H-A-T, Public Health Action Team. And there is lots happening with NACHO and throughout the country in terms of integrating real community engagement using great facilitation methods to further community health and public health. So if you want more information or contacts of people who are really involved with that, I'll be happy to give them to you afterwards. So you're going to have an hour and 15-minute demonstration of the methods. Generally, the introductory course is a 2-day course, and they're offered all over the country, and in Dallas and here in San Antonio, not in Austin. But it's a fabulous curriculum and a really worthwhile course. Lots of people from the Texas Dishes department have done it. They keep coming down to San Antonio because they like the Riverwalk and the training is really good. But so I would encourage you, if this whets your appetite, to go to the website and find out when you might want to do a course. In the meantime, here are some things that may not be intuitive about effective facilitation. One is, and you will see demonstrated in the other room where Kathy will work with you and in this room where I will work with half of you, You want to post ground rules. Not just assume that everybody, thank you. Not just assume that everybody knows how to act appropriately and be a good participant. You want them posted, and you want to give voice to them at the beginning of a meeting. And you want to ask the group, are you willing to abide by these as we go forward? And is there anything else you want or need to add in order for you to feel ready to work together? It is incredibly helpful to have them posted, because then when somebody is having a sidebar conversation or whatever, you can say, remember we agreed to these, without having to scold or anything. It's just a really powerful, easy, non-accusatory way of keeping people to a set of agreements. It's critical, and I can't tell you the number of clients I have who want to start out with, let's set the agenda, before they're really clear about what is the purpose of the meeting, what do we have to accomplish, what are the decisions or actions that we want the participants and that we need the participants to take. That is the hard work of creating an agenda. And really push yourselves and your colleagues to get real clear. Kathy kept talking about being clear about the purpose and about the mission. Well, it's about every single meeting also. What do we need to accomplish here? What do we need the group to do? A third thing is, as a facilitator, even though you are a public health professional and you may think that you have the best idea and the best answer, and you know what the community needs, and you know what you think they ought to decide, as a facilitator, you must be neutral, and you must just not participate in the deliberations. That's why Metro Health often hires me to come in, even though their staff has competence. There are some community issues that their staff expertise needs to be one of the voices in the room so that they can be, but they need to be an equal partner in it. So as a facilitator, you don't participate. It's critical that you remain neutral, and that's really hard when you are passionate about things. And have a sense, even though you're trying not to show it, have a sense of what it is you think is the best idea. So remaining neutral means to an idea that you may not think is or may not agree with, all the way to an idea you never thought of that you think is brilliant. Your job as a facilitator is to honor everybody's input and leave the group to their assessment and judgment. You just take them all in and affirm participation. That's what, as Kathy mentioned, it's really important that everybody participate. Another thing, before I had this advanced training, I did lots of facilitation. My training as a social worker and group work and community work, I worked with groups all my life. And I was very good at paraphrasing. If somebody would say something, raise community awareness, or get people to understand and agree on something, I would think a better way of writing that is increase community commitment. And I'd write that because I thought, aren't I smart? And this is a more succinct, more clear way of doing it. Well, it could be totally different from what the participant intended. So a part of the stance of the facilitator in honoring everybody's input is using their words. Using their words. And if other people need clarification of what those words mean, let them do that and then write the clarification. But don't paraphrase, because that's putting your interpretation, your lens, on their input. These are just some really basic things. Use dark colored markers when you're scribing. People with different vision abilities can't see red or green from far away, or orange. There's something, I'm not a scientist, but there's something about the length of the color wave that is harder for people who can't see distances to see. So use brown, black, dark blue, colors that people will be able to see. And appreciate that in every room, you've got all kinds of different learning styles. You've got some people and processing styles. You've got some people who want to get right to the decision and not talk about stuff and let's just make a decision and then we'll get by and we'll do it. You've got other people in there who are remembering a horrible experience of community engagement sometime in their past and are thinking, this is going to be same old, they're going to give lip service to everything, and then they're going to do whatever it is they want. And they're going to be just stuck in that little rat circle and not able to really engage in an authentic way. You've got other people who want to analyze things and talk about things forever and ever and ever. And then you've got people who just want to have a good time and want to relate to people and want to hear ideas and want to have fun. So in every room it's that. And no approach is right or wrong, but you need to be ready to try to address all those things. One of the things, this is a little advertisement, that you get in the training that you will not get today is the foundation of these facilitation methods is that without a group ever knowing it, you are hitting all those different learning styles, all those different processing styles. And so, by everybody getting their information processing needs met, they're able to get to a decisional point much more freely, much more quickly and efficiently. And that's part of, at the end of meetings with Metro Health, whether it's a Healthy Foods Coalition or a Safe Streets Coalition, Complete Streets Coalition or whatever, people say, I can't believe we accomplished this. I can't believe we got so far. But it's because of the power of the methods. And again, you'll see the surface of the methods, which are cool, and you can use them. I mean, hopefully you will walk out today with some ideas and some tools that you can take with you. But to really get it and make them more powerful, you want the training. So write this down, those of you who are taking notes. ICA-USA.org. ICA is the parent company that created and holds the copyright for the top methods. If you go to their website, and they are a community development organization that's involved all over the world, and they're turning 50 years old this year. If you go to their website and click onto top facilitation methods, you can find a listing of all of the trainings nationwide. So, with that, I think it's time for us to count off, and we're just going to count. Are there any burning questions? I mean, we want to get into the demonstration, and then at the end we'll have an opportunity to really have a little more conversation and questions. But are there any burning questions that you feel like you need addressed before we move forward? Okay. What we're going to do is count off 1, 2, 1, 2, 1, 2, and remember your number. I have been guilty of counting off, and then it's like, I can't remember. So remember your number, and let's just do it. Can we start with you?
1,
2, 1, 2, 1, 2, 1,
2,
1, 2,
1, 2.
Let's do 2 here, and then go back here.
2,
1, 2, 1, 1,
2, 1, 2,
1, 1, 2,
2,
1,
2.
1, 2, 1.
All right. So all the ones will move up closer here and stay with me. We're going to take about a 10-minute break.